we're wanting everyone to know about the flu campaign that we're running this autumn, and we've developed our way of delivering flu jabs to the fact that we're now going to deliver it as a flu jamboree, and it is a jamboree. It actually was fun, and I think we all actually enjoyed it. It sounds a bit bizarre, but we did, and a lot of the patients said they really enjoyed it. A lot of the people who lived through the war and things said it was very much like being in the army, and when they had their jabs in the army, except that we used sharper, cleaner needles, which they found reassuring. And a lot of people just remember, the sort of atmosphere was really, really positive. We felt like having wartime music and a band in the background. It was a fit.
You didn't have music though?
We didn't have music. We think we might. Maybe we ought to have some music. No. Practice managers thing in the background. So essentially it was just a really, really good atmosphere, and a lot of people sort of met up socially that hadn't seen each other for a long time. It was a huge range of age groups. The young people that came along gained confidence by the sort of laughter and humour of older people. So you had a real mix of the generations. So I think everybody sort of forgot they were coming for a flu jab and just saw it as a sort of big social occasion.
Great.
So we managed to do 600 flu jabs in a couple of hours last time, which is a sort of phenomenal sort of thing. So you're not going to be waiting very long at all if you come along, and it is actually the quickest, most efficient way, to get your flu jab. Everybody who's eligible to have one will receive a letter from us inviting them to that clinic, and we look forward to seeing everyone. If you're not able to attend on that day, and we recognise that not everybody can, then there will be other clinics working through surgery time that people can book appointments for. But I think if you want to have a quick and fun way of having your flu jab that we're all ready to deliver, this is the place to be.
And just to remind us of the importance of flu jabs, it seems to become much more prominent in recent years.
Yeah, flu jabs, your opportunity to protect yourself against a potentially serious illness. We've been fortunate over the last few years in that we haven't had a flu epidemic. But if there is one, then a lot of people get very sick quite quickly. And I think I remember the last one, and those who weren't immunised were pretty poorly. So basically, the flu jab, you have to have one every year at the moment, because the strains of the virus that are coming over from China change every year. So you have to have a different one to make sure we catch all the particular strains. But if you have a flu jab and there's a flu epidemic, you will protect yourself from a very potentially serious illness. And so we'd strongly recommend people just take a few minutes of their time to protect themselves against that illness.
And particularly vulnerable groups are?
Yeah, the vulnerable groups, the target groups are all people who are 65 and over, people who've got lung problems like asthma or chronic obstructive pulmonary disease, people who've had heart disease or strokes, people who are on medicines that might impair their ability to fight infection, like a lot of people take medication to control sorts of inflammation, arthritis or inflammation, bowel disorders, or those people who've had cancer therapy where your immune system may be a little bit flattened by the treatment you're having. Then the flu jab is very important to sort of give your body a head start really to fight off an infection. There is one particular group of people that we're most anxious to get the flu jab, that actually are probably one of the most vulnerable groups, who might not think that they're vulnerable, and that's pregnant women. It's very, very important that pregnant women consider having a flu jab. It won't affect your pregnancy at all or harm your pregnancy at all, but getting the flu in the middle of pregnancy could very much harm you and your child, and that will be one group of people that would be most anxious to come in and have their flu jab. Another very important group that should consider having a flu jab are people who care for other people. So if you're somebody who's a carer, you would identify yourself as a carer, you're also entitled to a flu jab. It's not us that decides who should have them. It's basically nationally decided by the Department of Health, and we're sent guidance in the late summer, early autumn, which describes exactly those groups that are entitled to have a flu jab. So if we're saying you can't have one, it's because we're following national guidance, not our own. It's not a matter of opinion, it's a matter of following the guidance.
And presumably anyone who's wondering about whether they are eligible would just contact surgery. And
Yes, they can ring up, and our patient support team will be able to help determine whether they're on the list of people who should have a flu jab or not. And as I said, we will be writing to everybody who is eligible for a flu jab to invite them to come to the flu clinic or to make an appointment at another date and time to get their flu jab done.
so party time at the surgery on the 22nd of September.
Very much so. We're looking forward to it. Everyone's up for it.
Thank you.
Thank you.